Hello, and welcome to another exciting video on health and fitness. Keto diet? Well, do you know it has several health benefits apart from weight loss? Yes, it has many health benefits, and this video will uncover its impact on weight and blood sugar levels. The ketogenic diet, or keto diet, is a low-carbohydrate, high-fat diet that aims to put the body in a state of ketosis, in which it burns fat for energy instead of carbohydrates. The diet typically involves consuming 70 to 80% of calories from fat, 10 to 20% from protein, and 5 to 10% from carbohydrates. By significantly reducing carbohydrate intake, the body is forced to use fat for energy, leading to weight loss. Foods allowed on the keto diet include meats, fish, eggs, non-starchy vegetables, nuts, and healthy fats such as avocado and coconut oil. Foods that are typically avoided include grains, sugars, fruits, and starchy vegetables like potatoes. While the keto diet can be effective for weight loss and has shown promise for certain medical conditions such as epilepsy and type 2 diabetes, it can also be challenging to follow and may have potential side effects such as fatigue, constipation, and nutrient deficiencies. It's important to consult with a healthcare provider before starting the keto diet. Keto has been shown to help people lose weight and improve their health. The basic idea behind the keto diet is to get your body into a state of ketosis, where it is burning fat for fuel instead of glucose. Here are some basics of the keto diet. Low carb. The keto diet is very low in carbohydrates, typically around 20 to 50 grams per day. This means cutting out most grains, sugars, fruits, and starchy vegetables. High fat. The keto diet is high in fat, with around 70 to 80% of your daily calories coming from fats. Good sources of fats include avocado, nuts and seeds, olive oil, coconut oil, and fatty fish. Moderate protein. The keto diet is moderate in protein, with around 20 to 25% of your daily calories coming from protein. Good sources of protein include meat, poultry, fish, eggs, and tofu. Ketosis. The goal of the keto diet is to get your body into a state of ketosis, where it is burning fat for fuel instead of glucose. This is achieved by reducing carbohydrate intake and increasing fat intake. You can find several different versions of the keto diet, including the standard ketogenic diet (SKD), cyclical ketogenic diet (CKD), targeted ketogenic diet (TKD), and high-protein ketogenic diet (SKD). And high-protein ketogenic diet have been studied extensively, while the other versions are more advanced and mainly used by bodybuilders or athletes. This low-carbohydrate diet has been used to help people lose weight, improve their blood sugar control, and manage certain medical conditions such as epilepsy. Here are some potential benefits of the keto diet. Weight loss. The keto diet may help people lose weight by reducing appetite and increasing satiety, leading to a reduced calorie intake. Improved blood sugar control. The keto diet can lower blood sugar levels and improve insulin sensitivity, which may benefit people with type 2 diabetes. Increased energy levels. Many people on the keto diet report increased energy levels and improved mental clarity. Reduced inflammation. The keto diet may reduce inflammation in the body, which is linked to a number of chronic diseases. Potential therapeutic benefits. The keto diet has been used as a therapy for certain medical conditions such as epilepsy, and it is being studied for its potential to help manage other neurological conditions and even some types of cancer. Though it has many benefits, however, it's important to talk to a healthcare provider before starting any new diet or exercise program. Apart from several benefits, the flip side is that there are many challenges and drawbacks associated with keto diet. These include 1. Restrictive nature. The keto diet requires a significant reduction in carbohydrates, which can make it challenging for individuals to adhere to the diet long-term. Additionally, it can be difficult to maintain a varied and balanced diet due to the restrictions on certain foods. 2. Risk of nutrient deficiencies. Because the keto diet limits many foods that are rich in essential nutrients, such as fruits and whole grains, there is a risk of developing nutrient deficiencies if the diet is not properly planned and balanced. 3. Has potential side effects. The keto diet can cause several side effects, including headaches, fatigue, constipation, and bad breath. These symptoms are often referred to as the keto flu, and can last for several days to a few weeks. 4. Increased risk of heart disease. While the keto diet may lead to short-term weight loss, it has been linked to an increased risk of heart disease in some individuals due to its high intake of saturated fats. 5. Limited research. Although the keto diet has gained popularity in recent years, there is limited research on its long-term effects and safety, particularly in certain populations such as pregnant women or individuals with certain medical conditions. 6. Cost. The keto diet may be more expensive than a typical diet due to the higher cost of foods such as meats, fish, and healthy fats. Keto and weight loss. The ketogenic, keto, diet is a high-fat, low-carbohydrate diet that aims to induce a state of ketosis, where the body burns fat for fuel instead of glucose. This dietary approach has gained popularity in recent years, especially among those seeking to lose weight. Several studies have investigated the effectiveness of the keto diet for weight loss, and many have found that it can be an effective strategy for losing weight in the short term. One randomized controlled trial published in the Journal of Clinical Endocrinology and Metabolism found that overweight and obese individuals who followed a keto diet for 24 weeks lost significantly more weight than those who followed a low-fat diet. Another meta-analysis of 13 randomized controlled trials, published in the British Journal of Nutrition, found that individuals on a keto diet lost more weight and experienced greater improvements in several cardiovascular risk factors, including blood pressure and cholesterol levels, compared to those on a low-fat diet. However, it is important to note that adherence to the keto diet can be challenging for some individuals, as it requires strict restriction of carbohydrates and high intake of fat. Additionally, the long-term effects of following a keto diet on weight loss and overall health are not yet fully understood. Overall, the keto diet can be an effective tool for weight loss in the short term, but it may not be sustainable or appropriate for everyone. It is always important to consult with a healthcare professional before starting any new dietary regimen. To sum up, the ketogenic diet, keto, is a high-fat, low-carbohydrate diet that aims to induce a state of ketosis in the body, where it burns fat for fuel instead of glucose. The diet involves consuming 70 to 80% of calories from fat, 10 to 20% from protein, and 5 to 10% from carbohydrates. The keto diet has shown promise for weight loss, improved blood sugar control, increased energy levels, reduced inflammation, and some medical conditions, such as epilepsy. However, it has several challenges and drawbacks, including its restrictive nature, risk of nutrient deficiencies, potential side effects, increased risk of heart disease, limited research on its long-term effects and safety, and cost. It is important to consult a healthcare provider before starting any new diet or exercise program. Thank you for watching this video.